Hello, my name is Julia Lewis, and I will be speaking today about the healthcare system in England, the National Health Service, known as NHS. As in the United States, there are two main health delivery system forms in England: primary health services, which are a combination of general practitioners, GPs, and community medical workers such as dentists, pharmacists, and optometrists, and secondary or acute services which are provided by hospitals. The NHS was established in 1948 immediately following World War II and is based on the core principles of comprehensiveness and solidarity. The plan has minimal out-of-pocket contributions and no fees at the point of service. NHS was developed by the Labour Party, and although the single-payer plan is considered to be socialized medicine, it has a high public satisfaction rating, and people of all political persuasions support its basic principles. In 2010, the NHS public satisfaction rating was approximately 70%. As for the United States, public satisfaction rating of general quality of U.S. healthcare in 2010 was 62%, while satisfaction of cost of healthcare in general was 26%. Personal healthcare cost satisfaction was higher, rating 62%. The system is funded by general progressive taxation, meaning the greater a person's income, the higher their taxes. The core attributes of NHS are comprehensiveness. Britain's NHS covers a person from cradle to grave, in fact even before the cradle, since prenatal care is included. Universality. Emergency and accident services, family planning, and treatment for infectious diseases are free for everyone who presents for care, whether a citizen, visitor, legal or illegal. Low user fees. Care is free at the point of service, but some specialty or non-emergency services require co-insurance or co-payment. Funding source. As mentioned earlier, the plan is funded by progressive general taxation of the population. Resource allocation. The NHS applies tools such as the Resource Allocation Working Party (RAWP) formula, which aims to allocate funds for its 4 regional areas so there is equal opportunity to access care for everyone who is at equal risk, eliminating inequalities. Purchasing and commissioning. The National Institute for Health and Care Excellence, NICE, oversees the purchasing and commissioning of services in the NHS. NICE attempts to ensure that the NHS only invests in services and technologies that are proven to work. NICE also attempts to end inequalities in access to care by targeting disadvantaged groups with its new social care programs. Ownership of healthcare delivery agents. The health system is a mix of public, private, and third sector, all under contractual agreements to provide care for NHS patients based on a fee schedule and quality standards. Coexistence with private systems. Private healthcare insurance policies are available, and these plans eliminate the wait times associated with NHS for non-emergency services. Some employers offer health plans to supplement NHS. However, few people totally opt out of NHS. Physicians can also supplement their income by setting up private practices that don't bill NHS and accept self-pay or private health insurance plans. And now for the pros and cons. The pros of Britain's national healthcare system are that there is no cost to the patient at the time of service. The system provides excellent quality of care, and access to care is universal. The national health system also provides services for lower cost to the public than the United States. In 2013, healthcare costs in the U.S. were 17.1% of the gross domestic product, compared to 9.1% in the United Kingdom. The con of NHS is that there are possibly long wait times for non-emergency services. The NHS website states that the maximum wait time after a referral is created by your GP for treatment is 18 weeks. In the U.S., insured persons have very short wait times for routine treatments and/or surgical procedures. Uninsured persons, however, must save up the funds and pay at the time of service or qualify for assistance prior to the service, all of which could take more than 18 weeks. This concludes my presentation on the National Health Service of England, known as the NHS. Thank you for your time and attention.